Hey everyone, this is Carrie Anderson. Hope you all doing well. In today's video, I'll talk about diabetes meal planning method. So if you like the video related to my health, I would like to request you all please to subscribe the channel, hit the bell icon and give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin. Let's go. Weight management. There appears to be a link between diabetes and obesity. Many people with diabetes may be aiming to lose weight or prevent weight gain. So, one way to manage weight is by counting calories. So, the number of calories that a person needs each day will depend on factors such as blood glucose targets, activity levels, height, sex, specific plan to lose, gain, or maintain weight, the use of insulin and other medication, preferences, budget, various dietary approaches can help a person achieve and maintain a healthful weight, and not all of them involve counting calories. So, the DASH diet, for example, focuses mainly on fruits, vegetables, whole grains, nuts, and seeds, as well as dairy product, poultry, and fish that are low in fat or fat free. It encourages people to avoid added salt, sugars, unhealthful fat, red meat, and processed carb. So the DASH diet is designed to improve blood pressure level in people with hypertension, but studies also show that it may help with losing managing weight. So a doctor can offer further guidance about weight management, that is a plate method. Getting the right nutritional content from food is important for everyone. So, the plate method uses the image of a standard 9-inch dinner plate to help people visualize nutritional balance as they plan their meals. So, the Centers for Disease Control and Prevention recommend imagining that a plate full of food includes 50% non-starchy vegetable, 25% lean protein such as lentils, tofu, fish, or skinless and fatless chicken or turkey, 25% high fiber carbohydrate such as whole grains or legumes. A person who needs a higher intake of carb can add to this plate a small amount of fresh food, a glass of 1% milk. Some oils can be helpful and low in carb but high in calories, so a person can use these oils to prepare food and add flavor, but it is important to consume them in moderation. So a limited amount of the following type of fat can support health. So a monounsaturated fat such as olive and canola oil and avocado, polyunsaturated fat such as sesame seeds and nuts, saturated fat present in coconut oil, animal fat, and dairy product can increase the risk of high cholesterol and cardiovascular disease. So, the current dietary guidelines for Americans recommend that 45 to 65% of an adult calories come from carbohydrate. Fewer than 10% of calories come from sugar. 20 to 35% come from fat, with fewer than 10% of these calories coming from saturated fat. 10 to 35% come from protein. So ask a doctor if these guidelines are suitable. Some people with diabetes may need a lower carb intake to manage their blood sugar level. So a carbohydrate control, one way to manage blood sugar level is to decide how many carbohydrate to consume each day and how to spread those among meals. So according to the National Institute of Diabetes and Digestive and Kidney Disease, people can then choose how to spend their carbohydrate by using a carbohydrate exchange list. So it ranks food according to the number of carb that they contain, making it simpler to swap one type of food for another. Experts no longer recommend a standard carb intake for people with diabetes, as each person has different requirement. Speak with a doctor about how many and what type of carb to consume each day, as well as how to disperse them throughout the day. So the type of carb can also affect the amount that a person can eat. Highly processed carb and sugar can raise blood glucose level quickly without offering any nutritional benefit. So the fiber, on the other hand, is slow to digest and can help with weight and glucose management. Current guidelines recommend a fiber intake of 28.0 to 33.6 grams each day for most adult. Males may need up to 38 grams per day. So the glycemic index ranks food according to how quickly they raise blood sugar levels. Food with high glycemic index scores increase blood sugar levels rapidly. These food include sugars and other highly processed carb. Foods with low scores contain no or few carbs, or they contain fiber. which the body does not absorb as quickly as processed carb. Here are some examples of carbohydrate rich food and their glycemic index scores. So the low glycemic index food with scores of 55 or less: 100% stone ground whole wheat bread, sweet potato with the skin, most fruit, whole oats. So the medium glycemic index food, which is 56 to 69: quick oats, brown rice, whole wheat, pasta bread. High glycemic index foods, which is 70 and above: white bread, roasted potatoes, candies, white rice, melon. So people with diabetes need to consider the type of carb as well as how many they consume. A doctor can give advice about this. So food exchange list: one way to keep track of carb is with a food exchange list. These lists can also group food with similar level of fats and proteins, and they may include subcategories of starches, fruits, milk, vegetable, meat, and meat substitutes, and fat, for example. Bringing it all together, a person can use all of the above strategies to create a meal plan. For example, using the plate method can help when determining portion size, and food exchange list can help ensure nutritional content. Counting carb and checking glycemic index ranking can help ensure that the diet is helpful. Outlook, which will be the people with diabetes should consider a number of factors when planning meals. A pre-made meal plan can help, but a person should adjust it to meet their needs. So that's all about the diabetes in this video. I hope you all liked it. One thing more I need to mention clearly: I'll presented a small presentation for all of you guys that will be going to help you 100%. I'm damn sure about it. That the link I will be going to share in the description box below. You can check it out from there and take a 100% use out of it. So that's all. I'll definitely meet you in the next video with my another content. Till then, God bless you all. Bye bye, take care. And before signing off, please do like, share, subscribe this video with the loved ones so that they can also gain the knowledge about this. So that's all. Bye bye, take care. God bless you all.